Hey everyone, welcome back. We're diving into something pretty heavy today.
Yeah.
Early adult death rates.
Mm.
They're way higher than anyone expected. And it's been building for a while now. We're looking at this new research article from JAMA Network Open,
Oh, yeah.
which is a pretty big deal in the medical world, right?
Absolutely. It's a top-tier journal, peer-reviewed, so very well respected.
And this study, it's called Mortality Trends Among Early Adults in the United States, 1999-2023. And it's from some heavy hitters, too, researchers at the University of Minnesota and Boston University School of Public Health.
Yeah, that's rigorous research for sure.
Okay, so give us the headline. What's got everyone so worried?
Well, by 2023, death rates for folks aged 25 to 44
Okay.
jumped a whopping 70% compared to what we thought would happen based on earlier data.
70%. That's a massive increase. And, for our listeners out there, this might be even more shocking because early adult death rates were actually going down for a whole decade before 2010.
Exactly.
So this isn't just a random spike. This is like a huge U-turn in the wrong direction.
It is. And of course, the pandemic hit everyone hard, but this research is saying COVID was more like fuel on a fire that was already burning.
Oh, interesting.
This trend was already happening before the pandemic came along.
So something else is going on here. What's driving this increase? What's killing young adults at this rate?
The biggest culprit is drug-related deaths. Tragic, really. And it's not just opioids, it's a whole mix of substances.
So it's a much bigger drug problem than people realize. But the research mentions that drug deaths are only one piece of the puzzle, right?
Absolutely. There's also been an increase in what I called cardiometabolic diseases, heart problems, strokes, diabetes, things we used to think of as old people problems.
Yeah.
But they're hitting young adults now, too.
Wow.
And then there are deaths related to nutrition, alcohol, even a jump in car accidents.
Okay, slow down. I need to catch my breath. It's not just one thing. It's a lot of different causes all feeding into this trend. It makes you wonder if there's some kind of connection.
That's the thing. The fact that there are so many different causes, it suggests a bigger problem, a decline in the overall well-being of young adults today.
Okay, so we know this isn't just a fluke. It's a trend with multiple causes all tangled up together. But why? What's behind this decline in well-being?
Well, the research doesn't have all the answers, but it does point to a few possibilities, and some of them might surprise you.
All right, hit me. What are we talking about?
One major factor is probably economic hardship and the stress that comes with it.
Yeah, that makes sense.
Think about it. Young adults today are dealing with huge student loan debt, wages that haven't kept up with the cost of living, crazy housing market. That kind of pressure can really mess with your health, both mentally and physically.
Yeah, it's tough to make healthy choices when you're always worried about money. Does the research say how this financial stress leads to those specific causes of death? Like, what's the link?
It seems like financial stress can create this domino effect. People may turn to less healthy food choices.
Right.
Maybe rely on substances to cope, and they might even put off going to the doctor because they can't afford it.
Yeah.
And all of that can trigger or worsen those cardiometabolic diseases and other health issues we talked about.
So it's like this chain reaction.
Exactly. It's all connected.
And it's not just about personal choices either. The researchers also point to a lack of access to healthcare and support services as another potential driver. Can you unpack that a bit?
Sure. In the U.S., healthcare is complicated and can be really expensive, so a lot of young adults simply don't have access to the care they need, especially things like preventive care or mental health services, which could really help prevent problems down the line.
And it's not just healthcare, it's that whole social safety net.
Right.
The programs and help that are supposed to be there if you're struggling, things like mental health support or addiction treatment.
Exactly. And when those safety nets aren't there or it's too hard to get help, people fall through the cracks.
We've got economic pressures, access to care. What else did the researchers find?
Well, this one's a bit tougher, but they also found that mental health challenges are increasing for this generation. We're seeing more anxiety, depression, and unfortunately, even suicide among young adults.
That's really sad.
It is. And while we don't fully understand all the reasons why, it's clear and it's playing a part in these rising death rates.
Yeah, for those of our listeners who follow these issues closely, this might not be new information, but what I'm hearing from this research is that things are actually much worse than we thought.
You're right. The scope of this problem is truly alarming.
Okay, so we've got financial strain, lack of access to help, a mental health crisis. Anything else?
One more factor the researchers highlighted was the influence of industries that have a huge impact on public health. Think like big food, big pharma.
Okay.
Their marketing and lobbying can sometimes push people toward unhealthy choices.
Interesting.
Especially if those folks are already dealing with all those economic and social pressures we talked about.
I'm curious about this. What's the connection between, say, the food industry and these death rates? It seems kind of indirect.
Well, think about it. If you're struggling financially and stressed out, you're more likely to go to those cheap, processed foods that are everywhere and heavily advertised, even though they're not very nutritious.
Uh-huh.
And over time, that can lead to those cardiometabolic problems like heart disease and diabetes.
So it's not a direct link. It's more like these industries are creating an environment where it's harder for people to make healthy choices.
Exactly. It's all part of the bigger picture.
Okay, so we've got this perfect storm brewing: economic hardship, lack of support, a mental health crisis, and these powerful industries all contributing to this disturbing trend. It's pretty overwhelming. But before we spiral into despair, I want to talk about solutions. What can we actually do to change this? The researchers are calling for big policy changes, but that feels so out of reach for most people.
Yeah, policy changes are important, but you're right, they take time. And while we work towards those bigger changes, there are things we can do on a personal and community level.
Okay, I like that. Let's break it down. What can our listeners do right now in their own lives?
Well, first, just connect with the young adults in your life. Check in on them, ask how they're really doing, and listen to what they have to say. Sometimes a genuine conversation can make a world of difference.
It's easy to forget the power of just listening.
It really is. And beyond individual support, think about your community. There are some amazing local organizations doing incredible work: food banks making sure people have access to healthy meals, mental health groups offering support, community centers providing resources and a sense of belonging. They need volunteers and donations to keep going.
I love that. It's about getting involved, becoming part of the solution instead of just reading about the problem. What else can we do?
Don't underestimate the power of your voice. We tend to think of policy change as something that happens out there, but it starts with us. Contact your elected officials. Tell them these issues matter to you. Support the organizations that are pushing for policies that promote health and well-being.
So write letters, share information online, all that good stuff.
Exactly. Every voice makes a difference. And finally, that might sound cliche, but take care of yourself. Setting a good example is incredibly powerful, especially for younger generations.
Yeah.
It's like that oxygen mask on an airplane. You have to help yourself before you can help others.
That's a great point. You can't pour from an empty cup. As we're talking about all this, I keep thinking about those interconnected causes we discussed. It's not just about tackling each problem individually. It's about shifting your whole mindset, right?
You got it. It's about moving away from that me-first mentality and embracing a we're all in this together approach. It's about creating a culture that prioritizes well-being for everyone, not just a select few.
I see what you mean about the policy solutions, but they seem so big. Is there anything individuals can do that will actually make a dent in these huge systemic problems?
It's easy to feel overwhelmed, but remember, real change starts at the grassroots level. Every time you choose to volunteer, donate, speak up, or even just have that honest conversation with a young person in your life, you're part of the solution. You're planting a seed.
Okay, I'm feeling a bit more hopeful, but I have to ask, what happens if we don't turn this around? What are the long-term consequences if these trends continue?
That's a question I think everyone should really consider. If we lose so many young adults, the impact on our workforce, our communities, our families will be felt for generations. It's not just numbers on a page. It's about real lives and real futures.
This brings up another important question. If these trends continue, what kind of world are we creating, not just for young adults, but for all of us?
Exactly. It's not just about them. It's about all of us. Their well-being is directly linked to our collective future. And that's why understanding this is so important. We need to get a handle on this problem in all its complexity before we can truly address it.
Well said. What I love about these deep dives is that we start with these alarming stats. And it can feel heavy. But then we get to this point where we're empowered to actually do something about it. It's not about dwelling on the problem. It's about finding a path forward.
What's really interesting here is that even though this research is focused on a specific age group, it's actually a reflection of the health of our entire society.
That's so true. And I think that's a powerful takeaway for our listeners. This is bigger than any one of us. But we all have a role to play in creating a healthier future.
Couldn't agree more.
This deep dive has given us a lot to think about, and I hope it sparks some ideas for our listeners. Any final thoughts you want to leave us with?
I'd encourage everyone to check out the full research article. We'll link it in the show notes and see what speaks to you. Think about what you're passionate about, what skills and talents you have to offer. How can you use your unique strengths to be part of the solution?
I love that. It's about finding your own way to make a difference. We're not all policymakers or doctors, but we all have something to contribute.
Exactly. And remember, even small actions, when multiplied by many, can create a powerful force for change.
Beautifully put. Thank you so much for sharing your insights with us today. This has been such an informative conversation.
It was my pleasure.
And to our listeners, we hope this deep dive has left you feeling informed, engaged, and maybe even a little fired up to make a difference. Keep learning, keep questioning, and keep diving deep.
So we were talking about solutions.
Right. Let's get practical. What can we actually do to turn this thing around? The researchers call for these big policy changes,
Yeah.
but that feels so far out of our control. Yeah.
It's true, policy changes take time, but while we're pushing for those larger shifts,
Yeah.
there's actually a lot we can do on a personal and community level.
Okay, I like that. Let's break it down. What can people listening do right now in their own lives?
Start with simple human connection. Just check in on the young adults. Ask them, how are you really doing? And really listen to their answer.
Yeah.
You'd be surprised how much a genuine conversation can help.
Sometimes we forget how powerful just listening can be.
Absolutely. And beyond that individual support, think about your community. There are so many great local organizations doing fantastic work. Food banks helping people get access to healthy meals, mental health groups offering support, community centers providing resources, and a sense of belong.
Yeah,
Those organizations rely on volunteers and donations to make a difference.
I love that. It's about getting your hands dirty and being part of the solution, not just reading about the problem. So what else can we do?
Don't underestimate the power of your voice. We often think of policy change as this big thing that happens way up there,
Uh-huh.
but it starts with us. Contact your elected officials. Let them know these issues matter to you. Support organizations that are pushing for policies that promote health equity. Make some noise.
So write letters, share information online, all that.
Exactly. Every voice adds to the chorus demanding change. And last but not least, and this might sound a little cheesy,
Yeah,
take care of yourself. Setting a good example is incredibly powerful, especially for younger generations. It's like that oxygen mask on an airplane.
right.
You have to help yourself before you can help others.
That's a great point. You can't pour from an empty cup. As we're talking about this, I keep thinking about all those interconnected causes we talked about. It's not just about fixing each problem on its own. It's about shifting our whole way of thinking, right?
You nailed it. It's about moving away from me first and towards we're all in this together, creating a culture that puts well-being first for everyone, not just a lucky few.
I hear what you're saying about the policy solutions, but they seem so huge. Is there really anything individuals can do that'll make a difference with these massive problems?
It's easy to feel overwhelmed, I know. But remember, real change starts from the ground up. Every time you volunteer, donate, speak up, or even just have that real conversation with a young person, you're part of a solution. You're planting a seed.
Okay, I'm feeling a little bit better now, but I have to ask, what if we don't turn this around? What happens if these trends keep going?
That's something I think we all need to consider. If we lose so many young adults, the impact on our communities, our families will be felt for generations. It's not just about statistics. It's about real lives, real futures.
This makes me wonder, if these trends continue, what kind of future are we creating? Not just for young adults, but for everyone.
That's exactly it. It's not just about them. It's about all of us. Their well-being is tied to our collective future. And that's why understanding this is so important. We need to understand the problem before we can fix it.
Well said. I love doing these deep dives. We start with these scary stats, and it can be heavy, but then we get to this point where it's like, okay, we can actually do something. It's not about getting stuck in the problem. It's about finding a way forward.
What's really fascinating is that this research, while it focuses on one age group, it really reflects the health of our society as a whole.
That's so true, and I think that's what our listeners should take away from this. This issue is bigger than any one of us, but we each have a part to play in building a healthier future.
Couldn't have said it better myself.
This deep dive has given us so much to think about, and I hope our listeners are feeling inspired. Any final thoughts?
Yeah, I encourage everyone to go read the full research article. We'll link to it in the show notes. See what resonates with you. Think about what you care about, what skills and talents you have. How can you use what makes you you to be a part of the solution?
I love that. It's about finding your own way to make a difference. We're not all politicians or doctors, but everyone has something to offer.
Exactly. And remember, even small actions, multiplied by many, can create a massive wave of change.
Beautifully put. Thank you so much for being here today. This has been such a great conversation.
It was my pleasure.
And all our listeners, we hope this deep dive has left you feeling informed, engaged, and ready to make a difference. Keep learning, keep asking questions, and keep diving deep. As we're talking about solutions, I keep thinking about those ripple effects you mentioned. What happens if we lose so many young adults? What does that mean for the future of our workforce, our communities, our families? As we're talking about solutions, I keep thinking about those ripple effects you mentioned. What happens if we lose so many young adults? What does that mean for the future of our workforce, our communities, our families?
It's a scary thought, really. This isn't just a statistic. It has real-world consequences.
Right.
Think about the economic impact. We're talking about a whole generation entering their prime working years, and we're losing a significant portion of them.
Exactly. It's not just the economy either. These are the people starting families, raising kids, contributing to their communities in so many ways. Their absence is going to have a huge impact for years to come.
Yeah, it's a loss that's hard to measure, but it's definitely significant, and it really highlights how important it is to address these problems now. We can't afford to wait.
This research is a really eye-opening. It's not just one problem, it's a whole system that seems to be failing young adults.
I agree. We've talked about drug-related deaths, but that's just the tip of the iceberg. We're seeing increases in deaths from preventable diseases, car accidents, things that suggest a lack of access to basic health care and support.
It's like a warning sign that something is seriously wrong. But what makes this generation so vulnerable? What's different now compared to, say, our parents' generation?
That's the big question, and I don't think there's just one answer, but there are some factors that are unique to this generation.
Okay, I'm listening. What are you thinking of?
Well, this generation is facing economic pressure unlike anything we've seen before.
Yeah.
They're graduating with tons of student debt, entering a job market that's really unstable, and they're struggling to afford basic things like housing and healthcare.
It's like they're getting hit from all sides.
Exactly, and that kind of constant stress can really impact their mental and physical health. It's no surprise that we're seeing more mental health problems and substance abuse in this age group.
It's like a pressure cooker and something's got to give. Is there anything else that you think is contributing to this?
Another thing is how social connections are changing. This generation is more connected online than any other,
Right.
but they're also experiencing more loneliness and isolation.
Wait, I don't get it. How can they be more connected online but lonelier in real life?
It's a strange thing, but online interactions don't always translate into those deep, meaningful, real-life connections, and that lack of real connection can be really harmful.
So it's not just about the economy, it's about the social fabric of our society, too. We're losing those traditional support systems that used to help people cope with stress and hardship.
Exactly. And that's why it's so important to focus on strengthening those support systems, investing in community programs, mental health services, and social safety nets that can help young adults through these tough times.
This deep dive has been a real wake-up call. It's easy to get caught up in our everyday lives, but when you step back and look at the big picture, it's pretty alarming. But I also feel a sense of hope. We've explored the problem, we've talked about solutions, and we've given our listeners ways to get involved.
And that's the key takeaway. This is a problem we can solve. It won't be easy, but we have the knowledge and the resources to make a difference.
I love that. It's not about feeling helpless. It's about choosing to act, to advocate, to support the well-being of young adults in our communities.
Exactly. Every step we take, no matter how small, adds to a larger movement for change.
Well said. Thank you again for joining us and sharing your expertise. This has been such a valuable conversation.
My pleasure.
And to all our listeners, we hope this deep dive has inspired you to learn more, to get involved, and to be a part of the solution. Remember, the future isn't something that just happens to us. We create it together.